Hey everyone, I'm Dr. Ariele Foster, physical therapist, yoga teacher, founder of Yoga Anatomy Academy. And today I have a quick practice to help those of you who are experiencing any discomfort in your hips. So this practice, just a quick caveat, is not medical advice. I definitely recommend it as an adjunct to the medical team that you can be working with. I'm especially a big fan of physical therapy, so if you have pain, go see physical therapy. And as far as your hip practice, you will want to have either a tennis ball or some kind of slightly larger, like lacrosse ball. I recommend something bigger than a golf ball because a golf ball is just kind of cruel and pointy for this particular practice. But I'm going to be using this rag roller duo. It is really handy, and a lot of the way that it's helpful, it's very much like a lacrosse ball, but a little bit softer in this particular one, or about the same. But because it's a duo, you can kind of spread the intensity out, and it's much less likely to pop out and fly away. But the way we're going to start is on our backs. So first, come onto your back. You'll draw your knees towards your chest, and you'll make two fists. And this practice is a practice of setting your pelvis. So a lot of times for those with hip pain, you have unevenness in your pelvis. So you're going to make the two fists, squeeze them, place them between your thighs, and then squeeze in about 30%. You're not trying to crush your hands, you're just squeezing for 5, 4, 3, 2, 1. Cup your hands over your knees. Shake it out, jiggle your knees a little bit. You can also draw some really sweet circles. This is called sacral massage. This is what I know it as from the Kripalu tradition. And then you're going to put your hands to the outside of your knees and push your knees out into your hands. Again for 5, 4, 3, 2, 1. Jiggle your legs, circle them up. Two fists, squeeze in. 5, 4, 3, 2, 1. I also recommend flattening your back as you do this. Cupping the hands over the knees. Circle, circle, circle. Anything that feels good, and then push the hands to the outside, knees into the hands. You can do a third round of that, especially if you feel that you are experiencing some unevenness in your pelvis. And you may even just slide your hands under the back of your pelvis and just feel whether one side is heavier on the hand or not. And just do some little pulsations to whatever side feels like it is less on the floor, right? Kind of rocking that side pelvis back, etc. Now is a great time to grab whatever myofascial release tool you're using and stick it under the meat of your glutes, so the kind of bulky part of the back of your buttocks. And it's really this simple. You don't have to do anything too fancy, just gentle rocking, sliding and gliding. When you find that you have a good spot, you can hang out there and do what I call oscillate. Or you can even just drape your body for about 5 breaths. I would recommend staying on the muscle, staying on the meat of your muscle, rather than on any bony area. But you can do all sorts of fun things back here, just kind of rolling back and forth because there is so much muscle, so much soft tissue. If you have spent about 30 seconds on one side, we're going through it a little bit quicker today than you can do on your own, but we're going to switch the ball to the other side and then also do similar kind of gentle rocking, oscillations, changing the amount of weight, kind of putting it on or off. And just generally, just finding the spot that feels really good to you. It could be close to your sacrum, close to the bone in the back of your pelvis. It could be surprisingly close to your low back, but not on the low back, not on the bony areas. Or it can be closer down towards your sitting bones. There's another spot that we're going to get to, so let's call that 30 seconds. And this next spot is between the top of the pelvis and the side of the pelvis, the side of the hip. So you can feel a little bit of a slightly bonier area on the side of your hips. The part that, like, if you kind of bumped it against somebody the wrong way, you would be a little uncomfortable there. And the top, so there's a small strip of muscle in between, muscle and fascia and tendons, and we're going to get right over that. And it's a little bit tricky to get to, so just kind of experiment until you get one of those oh wow moments, and that's usually it. This is the place where the duo really comes in handy. It's called, the muscle I'm aiming for here is tensor fascia lata, and it is the muscle that is embedded in the IT band. There's a lot of intermuscular woven connective tissue commonalities and lines of pull, but that's one that is really, really obvious even through a traditional dissection. So you can see me just oscillating, rocking back and forth a bit here. On the back side, you might also feel gluteus medius and minimus, which are often really weak on people who have hip pain. We're going to switch sides. So let's get to the other side. Again, this area is basically the pocket area where you might slide your hand into a pocket on your jeans. And you're going to rock back and forth, just gently and sweetly, oscillating, maybe draping, definitely doing some deep breathing. Never ever chase pain while you're doing myofascial release, because part of the magic and beauty of myofascial release, at least as we know it now, is the neurophysiology. So essentially the way that our nervous system interprets the sensation is kind of a process of normalizing the deep pressure and potentially on the local cellular level even flushing out and bringing in new blood flow. So it's not about going through and pushing through, but really about like allowing your body to adapt to that pressure. Okay, we're going to come face down now, so no more need for a myofascial release technique or tool. You can just rest your forehead on the back of your hands. And this next technique is really, really simple. It's just squeezing your bum. So just squeeze and press like you really, really, really like the floor. And hold for 5, 4, 3, 2, 1, and relax. Shake your pelvis out a little bit, and then press and squeeze. 5, 4, 3, 2, 1, and relax. And squeeze it out, or shake it out, and press and squeeze. 5, 4, 3, 2, 1. Okay. So we're going to use that same technique of pressing into the floor. Slide your hands under the front of your pelvis, and I want you just to notice if the pressure from the bones are even right to left. So you can pay attention to how much of the left front pelvis and how much of the right front pelvis are hitting the floor and whether it feels even or not. You want to do your best to make that even, and you want to do your best to make sure there's no gap between the front of your pelvis and the floor. So keep the bones in contact with the floor or with your hands. Bend your right knee and slowly tick-tock this right foot out and in, out and in. I recommend practicing this for about 20 repetitions. We'll just do about 10 today together. And release, bend your left, and switch. And so one of the things you're looking for here is that the pelvis stays super level on the ground. Perfect. And set your hands up. We're going to float the chest up, squeeze the shoulder blades, muscles back, and then float the legs up off the floor together. So this is a classic yoga shape, Shalabhasana. Arms back, perhaps I want you to really focus on lifting from the backside, getting a little air under your thighs. Don't worry about legs together, any of that stuff that sometimes yoga teachers will say. Fold yourself forward and relax, shake it out again. And then just do the right leg. Just the right leg this time. Don't push your left leg into the ground at all. Just float the right. So my left is floppy. I'm not turning, I'm not lifting that right side pelvis. And then lower. And left leg lifts. And again, the right leg is floppy. I'm not lifting my left side pelvis. I'm not crunching the left side low back. I'm just really trying to activate these muscles on the back side. And lower down. And then come up to kneeling. And certainly give yourself some cushion here as you need. But you're going to step your left foot forward and just readjust. Kind of front hip points up, pelvis forward. Start to press. Little pulsations. It's not a whole lot. That's the 6 o'clock position of the foot. And then we're going to go to about, if the right leg's back, you go from 6 o'clock to 7 o'clock. And again, a couple of pulsations. Eight o'clock, a couple of pulsations. Totally okay that your pelvis is starting to turn. And let's switch sides. So right leg forward, left leg back. Start with your foot towards 6 o'clock. And just go through some pulsations. Now you'll notice that from a yoga perspective, this is very different from Anjaneyasana, which we might sometimes do. This is a pretty extreme position of the back hip. So if you know you have cartilage damage or you suspect you might have some cartilage damage, don't go to the extreme. Just stay through center and stay strong through center. So smaller movements, but using your muscles to help support the joint rather than hanging in the joint is going to be much better long-term strategy. Go to 5 o'clock with your back foot. A couple of pulsations. Again, I'm looking for the pelvis to lead the way, not the belly button. So a couple more pulsations. Cushion your back knee with a blanket if you wish. We'll go to 4 o'clock. Last couple of pulsations here. And then take any kind of comfortable seat. So the things that we went through were the face downs, squeezing the glutes, the windshield wiping of the hips. This was the face down section. And then face up, we squeezed in and pushed out a few times. And we also did some myofascial release. We came up to kneeling after doing locust pose, and we did those pulsations in half kneeling around the clock, just around about a quarter of the clock. So what we're looking for with all of these is posterior strength in the glutes, good internal and external rotation of the hip in the socket, and just generally building on intelligent range of motion that's not extreme, and intelligent strengthening within that more modest range of motion, and integrating it with our core and our legs and all of that. If you want more information on the kind of stuff that I teach, including my workshop, Posterior Chain Awakening, you can go to yogaanatomyacademy.com or sacredsourceyoga.com. My name is Dr. Ariele Foster, and it is a pleasure to teach you today and to have your attention. Thank you so much.